They didn't know the new nurse was a combat surgeon until a Marine's heart stopped beating in the courtyard. Sergeant Tyler Kane collapsed on ordinary pavement under ordinary sunlight. His pulse disappeared before the gurney reached the ER. The team fought hard, trained hard, but they were losing him. Then Claire Maddox stepped forward. Not the quiet new hire who restocked supplies and kept her head down, not the woman everyone thought they knew. Someone else entirely. Her hands moved with precision that doesn't come from textbooks. Her voice cut through chaos like she'd commanded under gunfire before. In 3 minutes, she dragged a dying man back from the edge. And now everyone's asking the same question: who are you really? This is a story about the warriors we never see, the skills they carry, the secrets they bury, and the moment truth breaks through. Drop a like if you're watching, comment where you're from, and stay until the end because what Claire is hiding will change how you see every nurse, every veteran, every quiet professional who's seen war and chosen peace. But before we understand who Claire Maddox really is, we need to go back to before the courtyard, before the code, before anyone knew her name meant anything more than a badge on fresh scrubs. 3 weeks earlier, Claire walked through the front entrance of Harborview Regional Medical Center, carrying nothing but a canvas bag, and the kind of quiet most people mistake for shyness. Portsmouth, Virginia in early autumn feels like the edge of something. The air carries salt from the harbor and jet fuel from the bases. You can hear helicopters if you listen. Claire had learned not to listen. The HR office smelled like new carpet and budget coffee. A woman in a coral blouse smiled too brightly and gestured to a chair that squeaked when Claire sat down. "First day jitters?" the woman asked, already typing. "No, ma'am," Claire said. Her voice was polite, neutral, the kind of voice that disappears in a crowd. The badge printer clicked and hummed. A laminated rectangle slid into the tray. The woman picked it up, checked it against her screen, then handed it across the desk. "Claire Maddox, RN. Employee ID 47821. Blue stripe along the bottom edge indicating general nursing staff. "You're all set," the woman said. "Director Morales will meet you upstairs for orientation." Claire clipped the badge to her scrub pocket. The weight of it felt strange, too light, too simple, like wearing someone else's name. She thanked the woman and left. The elevator ride to the 4th floor gave her 38 seconds to reset her face. She counted the floors, watched the numbers climb, let her breathing settle into the rhythm she'd practiced. When the doors opened, a woman in navy scrubs stood waiting with a clipboard, and the kind of smile that suggested she'd already made up her mind about you. "Claire Maddox?" the woman asked. "Yes, ma'am. Janet Morales, Director of Nursing. Welcome to Harborview." They shook hands. Janet's grip was firm but brief, assessing without being obvious about it. "You've got ER overflow and step-down rotation until we finalize permanent placements," Janet said, already walking. Claire fell into step beside her. "We run a tight ship here, but we're not unreasonable. You'll float between units as needed. Questions? Where are the crash carts stored?" Janet glanced at her. "Each unit has primary carts at the nurses' stations. Backup equipment is in the supply alcoves. Why? Just like to know the layout," Claire said. "Smart." Janet's approval was small but real. "You've worked trauma before." "Different settings," Claire said, not a lie, just incomplete. They turned down a corridor that opened into the main ER. Controlled chaos. Phones ringing, monitors beeping. A child crying somewhere behind a curtain. The smell of antiseptic and anxiety. Janet pointed out the med room, the break room, the supply closet, the doctor's station. Claire memorized everything with the same attention she'd once used for mapping forward operating bases. "You'll shadow with Nurse Chen today," Janet said, nodding toward a woman in purple scrubs reviewing charts at a computer. She'll get you oriented to our protocols. First week is mostly observation. Learn the rhythm before you jump in." "Understood." Janet studied her for a moment. "You're quiet." "I listen well," Claire said. "Good trait in a nurse." Janet checked her watch. "I'll leave you to it. Any problems, page me." She left. Claire stood at the edge of the ER, watching the flow. 4 bays visible from where she stood, 2 occupied, 1 with an elderly man on oxygen, 1 with a teenager holding an ice pack to his ankle. Nurse Chen looked up, saw her, and waved her over. "You're the new hire." "Claire." "Amy, you look lost." "Just getting my bearings." Amy handed her a tablet. "Here's our charting system. It's clunky, but you'll get used to it. Come on, I'll show you the supply setup." They walked to a large closet that smelled like sterile packaging. Shelves lined both walls. Everything labeled, everything organized by someone who understood emergency access. Amy talked while she pointed. "Gauze here. IV supplies here. Intubation kits on the top shelf. Crash cart backup is in the alcove around the corner." "Can I see the alcove?" Claire asked. Amy raised an eyebrow. "You really are a planner." They walked 15 feet down the hall. A recessed space with a second cart, additional oxygen tanks, spare monitors. Claire's eyes swept the setup. She noted the defibrillator placement, the airway equipment, the medication drawers. "You always this thorough?" Amy asked. "Habit," Claire said. "Where'd you work before this?" "Around." Amy laughed. "Okay, mysterious. I get it. Fresh start, clean slate. We've all been there." Claire didn't correct her. They returned to the ER floor. The rest of the morning unfolded in mundane rhythms. Claire restocked supplies, watched vitals, observed Amy's interactions with patients, took notes on the hospital's specific protocols. She asked questions at careful intervals. Not too many, not too few. "How long does pharmacy take for stat orders?" 20 minutes average. "What's the typical response time for a code under 2 minutes if it's in-house?" "Where does the trauma attending usually stand during resuscitations?" "Left side of the bed near the airway." Amy never asked why Claire wanted to know these things. Maybe she assumed it was new hire diligence. Maybe she didn't care. At lunch, Claire sat alone in the break room with a sandwich she'd brought from home. She ate slowly, chewing each bite the way she'd learned to do when meals were uncertain and you didn't waste anything. Through the window, she could see part of the hospital courtyard. Trees, benches, a stone path winding between flower beds that someone tended with more hope than skill. Peaceful. Claire looked away. In the afternoon, she reorganized a supply drawer that didn't need reorganizing. But when she finished, everything was positioned differently. Faster access, less fumbling, built for someone who might need to grab things without looking. Amy walked past, saw the drawer, and stopped. "Did you just redo all that?" "It was inefficient," Claire said. "It was fine. Now it's better." Amy stared at her. "You're going to be either my favorite person or my biggest headache." Claire almost smiled, maybe both. The rest of the week followed a similar pattern. Claire observed. Learned names, memorized routines, kept her head down and her hands busy. She met Dr. Logan Price on her 3rd day. He was reviewing a chest x-ray when she walked past with a medication tray. "You're new," he said without looking up. "Yes, sir." ER rotation. "And step down." He glanced at her then. Quick assessment, dismissed just as fast. "Welcome aboard," he said, already returning to the film. Claire kept walking. She saw the Marine for the first time on her 5th day. He was in the physical therapy wing, visible through the glass partition that separated the gym from the main hallway. Tall, lean, in that wiry way that comes from training, not genetics. His left arm was in a sling, but he was doing single-arm cable pulls with his right jaw set against whatever his therapist was saying. Claire slowed her pace just enough to read the scene. The therapist, a man in his 50s with kind eyes, and the patience of someone who'd spent years convincing stubborn people to heal properly, stood with his arms crossed. "Sergeant Kane, if you don't let that shoulder rest, you're going to set yourself back another month." The Marine Kane didn't stop pulling. I'm fine. You're compensating. Your form is off. My form is fine. Tyler. The therapist's voice shifted, firmer. Stop. Tyler released the cable. It snapped back against the weight stack with a metallic clang that echoed in the small gym. I just need to work, Tyler said. You need to heal. Same thing. It's really not. Tyler turned away. Rolled, his good shoulder winced when the motion pulled at the injured one. His frustration was visible in every line of his body, the restless energy of someone built for movement who'd been forced into stillness. Claire kept walking. Not her business, not her patient, but she'd seen that look before. On young soldiers trapped in field hospitals, on Marines waiting for medevac, on people whose entire identity was wrapped up in what their bodies could do, suddenly confronting limits they'd never imagined. It never ended well if they didn't learn to listen. Over the next week, Claire saw Tyler 3 more times, always in the therapy wing, always pushing harder than he should. Once on his phone in the hallway, voice soft in a way that suggested he was talking to someone he didn't want to worry. She never introduced herself, never had a reason to, but she noticed the way he walked the hospital corridors like he was on patrol, the way his eyes tracked movement, the way he nodded at staff but never really engaged. A soldier in foreign territory counting the days until extraction. Claire understood that more than she wanted to. Her second week at Harborview settled into routine. She floated between ER overflow and the step-down unit, changed dressings, monitored vitals, passed medications, had the same small conversations with patients that every nurse has. How's your pain? On a scale of 1 to 10, when did you last eat? Do you need help to the bathroom? She was good at it. Efficient, thorough, forgettable in all the right ways. But there were moments when the mask slipped. Once in the ER, a woman came in seizing. The resident on duty froze for half a second, overwhelmed by the sudden violence of it. Claire was at the bedside before she remembered she wasn't supposed to be. Roll her to her side, she said, hands already moving. Protect the airway. Time it. The resident blinked. I know how to. Then do it. He did. The seizure lasted 48 seconds. When it stopped, the woman was breathing. Safe. The resident was staring at Claire like he'd just watched her pull a rabbit out of a hat. How did you move that fast? He asked. Practice, Claire said, and walked away before he could ask what kind. Another time, late shift, a man came in with chest pain. Classic presentation. Crushing substernal pressure. Radiation to the jaw. Diaphoresis. The attending ordered an EKG. Claire was already pulling the leads from the drawer. She placed them with mechanical precision. 12 lead. Perfect placement. No hesitation. The attending noticed. You've done that before, he said. Few times. Where'd you train? Nursing school, Claire said. True as far as it went. She didn't mention the field hospitals, the forward operating bases. The times she'd placed EKG leads on soldiers with dirt still in their wounds and mortars landing close enough to feel in your chest. The attending let it go. But Claire felt the weight of these small moments accumulating. Each one a crack in the careful anonymity she'd built. She couldn't afford too many more. On her 10th day, she took her lunch break in the courtyard. It was a Tuesday, warm for October, the kind of day that makes you forget winter is coming. She sat on a stone bench near the east entrance, unwrapping the same turkey sandwich she brought every day. Around her, the courtyard breathed with quiet life. A volunteer watered flowers near the fountain. 2 visitors sat on a bench across the path, talking in low voices. Somewhere, a radio played soft jazz. Normal. Civilian. Safe. Claire ate slowly, tasting nothing. She was halfway through the sandwich when Tyler Kane walked into the courtyard. He didn't see her. He was on his phone, walking the perimeter path with that same restless energy she'd noticed before. His sling was gone now. Progress. But he still moved carefully, protecting the healing shoulder. Claire watched him over the edge of her sandwich. He paced while he talked. 20 feet in one direction, turned 20 feet back. An old habit. She'd seen officers do the same thing on secure calls. Like walking helped them think. His voice carried just enough for her to catch fragments. "No, Em, I'm good. Yeah, therapy is fine. Don't worry about me, worry about your midterms," Sister Claire guessed. Younger, probably. Someone he was used to protecting. Tyler listened to whatever the person on the other end was saying. His expression softened in a way Claire suspected most people never saw. "You're going to be a great nurse, Em. Stop doubting yourself, because I know you. Kane blood, we finish what we start." He laughed at something she said, genuine, unguarded. Then he noticed Claire watching. The laugh faded. He nodded once, polite, distant. Claire nodded back. They were strangers sharing a courtyard. Nothing more. Tyler finished his call and left through the west entrance. Claire finished her sandwich and returned to work. She didn't think about him again until later that night, lying in her small apartment staring at the ceiling when she realized she'd cataloged everything about that brief moment. His gait, his posture, the way he favored his left side, the places where old training showed through civilian recovery. She recognized him because she was him. Different war. Different wounds. Same struggle to figure out who you were when the fighting stopped. Claire rolled over and stared at the wall instead of the ceiling. It didn't help. The third week started with a staff meeting. Claire didn't know. Yeah, she was supposed to attend until Amy texted her at 6:45 in the morning. Conference room B, 7 a.m. Bring coffee. Morales hates repeating herself. Claire arrived at 6:58. The conference room was already half full. Nurses, techs, a few residents. Dr. Price sat in the back corner reviewing something on his phone. Janet Morales stood at the front with a projected slide deck and the expression of someone who'd rather be anywhere else. Claire found a seat near the door. The meeting covered the usual hospital politics. New charting requirements, updated isolation protocols, a reminder about parking permits. Janet spoke with efficient boredom, reading through slides she'd clearly presented a dozen times before. Claire half listened, watching the room instead. The way people sat told stories. Who was friends with who? Who was exhausted? Who was checking out? Small hierarchies playing out in seating choices and body language. She'd learned to read rooms like this, in briefing tents, command posts, places where understanding the invisible dynamics could save your life or at least make it easier. Old skills, still useful. The meeting ended at 7:30. People filed out with the slow reluctance of those heading toward a long shift. Claire was almost to the door when Janet called her name. "Maddox, moment." Claire stopped, turned, waited. Janet approached with her clipboard and that assessing look she seemed to specialize in. "How's your first 2 weeks been?" "Good, ma'am. Still learning the rhythm. Any concerns?" "No, ma'am." Janet studied her. "You're very formal." "Habit. Military." The question landed soft but sharp. Claire's face didn't change. "Yes, ma'am. Army. Served my time. Combat. Deployed twice." The lie came smooth. She'd deployed 3 times, but 2 sounded less intense, less likely to trigger follow-up questions. MOS. 68 Whiskey. Combat medic. Another lie. Smooth as the first. Her actual designation had been far more complex, but 68 Whiskey was common enough, unremarkable enough. It explained the competence without raising flags. Janet nodded slowly. "That explains the efficiency, ma'am. The way you move, the way you organize. It's clinical, but it's also—" She paused, searching for the word. "Tactical." Claire said nothing. "We get a lot of veterans here." Janet continued. "Portsmouth is a military town. Most of them do well, some struggle. If you need resources, employee health has contacts. I appreciate that, ma'am. I'm doing fine. See that you stay that way." Janet's voice shifted less formal. "We're glad to have you, Claire. You're good at this. Don't burn yourself out trying to prove it." "Yes, ma'am." Janet walked away. Claire stood in the empty hallway for 10 seconds, breathing carefully before heading to her shift. The third week blurred into routine, punctuated by small moments of almost visible, almost too competent, almost caught being more than she claimed to be. She restocked a crash cart and organized it with battlefield efficiency before catching herself and deliberately messing it up to look more normal. She predicted a patient's respiratory decline 30 minutes before the monitors caught it, then pretended she'd just noticed when everyone else did. She heard helicopter rotors in the distance and froze in the middle of a hallway, heart pounding until they faded, and she could breathe again. Small fractures in the careful control she'd built. She saw Tyler twice more that week. Once in the cafeteria, sitting alone with a tray he wasn't eating, staring at his phone like it held answers he didn't want. Once outside the main entrance, waiting for a ride, his good hand flexing and relaxing in a rhythm she recognized. Stress management. Grounding technique. The kind of thing they teach you when you come back and the world feels too fast. They didn't speak, but she felt the weight of recognition anyway. 2 soldiers pretending to be civilians. Pretending the war stayed behind when they came home. Pretending the skills and scars and hypervigilance were things you could take off like a uniform. On her 15th day, late afternoon shift, Claire was restocking exam rooms when she heard raised voices from the therapy wing. Tyler and his therapist, again. "I said I'm fine. And I'm telling you you're not ready. How would you know you've never done this?" Done what exactly? Any of it. You don't know what it takes to get back to operational status. You don't know what happens if I can't. Claire paused outside the door. She shouldn't listen. Wasn't her business. She listened anyway. The therapist's voice dropped, gentler. "Tyler, you're recovering from a significant shoulder injury. Pushing too hard isn't brave, it's stupid. I don't have time to go slow. Your body disagrees." Silence. Then Tyler's voice quieter. "What if I can't get it back? What if this is as good as it gets? Then you adapt. Like everyone else who gets hurt. I'm not everyone else. You're human. That makes you exactly like everyone else." More silence. Claire walked away before she heard the rest. That evening, finishing her shift, she found herself back in the courtyard. Last light. The volunteers had left. The visitors were gone. Just Claire and the sound of water in the fountain and the distant hum of the city. She sat on the same bench she'd used before. Watched the shadows lengthen across the stone path. This place would matter soon. She didn't know how she knew. Just a feeling. The kind of premonition that combat teaches you to trust, even when it doesn't make sense. Something was building. Some confluence of time and place and fragile bodies pretending to be stronger than they were. Claire stood. Walked the path Tyler had walked. Counted her steps. Noted the sightlines. The distance to the nearest entrance. The time it would take to get a gurney through those doors. Old habits. Useful ones. She left the courtyard as the last light faded. Behind her, the fountain kept running. The flowers kept growing. The peaceful space kept existing in its innocent ignorance of what was coming. 3 days later, Tyler Kane would collapse on that exact path. His heart would stop beating in that exact courtyard. And Claire Maddox would stop pretending to be just a nurse. But tonight, walking to her car under autumn stars, Claire didn't know any of that yet. She just knew that Harborview felt like a place where her past was catching up to her future, and she had no idea how to outrun both at the same time. 3 days later, the morning arrived with the kind of brightness that makes you believe nothing bad can happen. Tuesday, October 15th. Temperature climbing toward 72 degrees by noon. Light wind from the southeast carrying the smell of harbor water and cut grass from the grounds crew working near the parking lot. Claire arrived for her 7 a.m. shift and found the ER quieter than usual. 2 patients in holding, 1 awaiting transport. The overnight crew looked tired, but not destroyed. A good sign. Amy was restocking the medication room when Claire clocked in. "Morning, mysterious," Amy said without looking up. She'd started calling Claire that after the 2nd week. Claire didn't discourage it. Better a harmless nickname than real curiosity. Morning, what's the board look like? Light, enjoy it while it lasts. Full moon in 3 days. Claire didn't believe in the full moon theory. She'd seen chaos happen under every phase. But hospital staff clung to their superstitions like sailors to knots. You didn't argue. She took her assignment. 4 patients and step down. Routine monitoring. Medication passes. Nothing complicated. The morning unfolded in comfortable rhythm. Vitals every 4 hours. Chart updates. A family meeting with Dr. Price about discharge planning for an elderly woman recovering from pneumonia. Claire stood in the corner taking notes while the family asked questions Price had already answered twice. Patience was part of the job. At 9:30, Claire did her rounds. Each patient got the same attention. Eye contact, questions they could answer. Assessment disguised as conversation. The elderly woman was improving. Lung sounds clearer. Oxygen saturation holding steady without support. The post-surgical patient in bed 3 was managing pain well. Incision site clean. No signs of infection. The diabetic in bed 7 was frustrated about the insulin schedule but compliant. Blood sugars trending toward normal. The motor vehicle accident patient in bed 2 was sleeping. Concussion protocol. Vitals stable. Glasgow coma scale 15. Wake him every 2 hours. He hated it. Claire didn't blame him. By 11, she'd charted everything, returned 3 phone calls from worried family members, and helped a confused patient find the bathroom for the 4th time that shift. Normal? Unremarkable. Exactly what she'd wanted when she took this job. She was updating a medication list when her phone buzzed. Text from Janet. Can you cover ER lunch breaks short-staffed? Claire replied, yes, ma'am. At 11:40, she headed downstairs. The ER had picked up since morning. 6 beds full. Waiting room had 8 people, nothing critical but steady, the kind of volume that kept everyone moving without panic. She found Amy at the nurse's station looking harried. Thank God, Amy said. I haven't peed in 4 hours. Go, I've got it. Amy practically ran toward the bathroom. Claire scanned the board. Chest pain in Bay 2, awaiting cardiology consult. Possible fracture in Bay 4, waiting for X-ray. Kidney stone in Bay 1, getting fluids. Abdominal pain in Bay 6, labs pending. She checked the crash cart out of habit. Fully stocked. Defibrillator charged. Airway equipment in place. Ready for something that probably wouldn't happen. Dr. Price was reviewing films at the computer. He glanced up when Claire approached. Maddox, you're downstairs. Covering lunch. Bay 2 needs another EKG in 15 minutes. Cardiology wants a comparison. I'll handle it. She set a timer on her phone, moved to the medication room, verified orders, pulled what was needed, labeled everything, returned to the floor. The ER hummed with contained urgency. Phones ringing. Call bells chiming, a child crying in Bay 5, the particular sound of a hospital in motion, neither crisis nor calm. Claire delivered medications, checked IVs, adjusted a monitor that was giving artifact readings, helped a nurse with a difficult blood draw. At 12:15, her timer went off. She grabbed the EKG machine and headed to Bay 2. The patient was a man in his 60s, anxious but stable. Classic cardiac risk profile. Overweight, history of hypertension, crushing chest pain that had brought him in 90 minutes ago. First, EKG had been equivocal. ST segment changes that could be normal variant or could be ischemia. Troponin levels pending. Claire introduced herself, explained what she was doing. Placed the leads with practiced efficiency. The machine printed the 12-lead strip. She reviewed it while pulling the leads off. The changes were still there. Maybe slightly worse. Maybe not. Cardiology would read it and decide. She handed the printout to Dr. Price. He studied it with the expression of someone trying to read tea leaves. Could go either way, he muttered. Troponin back yet? Claire asked. 10 more minutes. Want me to call cardiology with an update? No. Let's wait for the full picture. Claire nodded, filed the information, moved on. At 12:30, Amy returned from her break looking moderately more human. You're a saint, she said. Just a nurse. Same thing in this place. Claire almost smiled. She was about to head back upstairs when the ER entrance doors opened and a woman in a green volunteer vest walked in carrying a flower delivery. Ruth Bennett. Claire had seen her around. Older woman, maybe mid-60s, always cheerful, always chatting with patients. The kind of volunteer who'd been doing this for years because it gave her purpose. Ruth waved at the front desk. Delivery for Kane, Tyler Kane. You know where he is? The desk clerk checked the computer. He's not admitted. Maybe outpatient, physical therapy, Claire said. She didn't know why she knew that. Hadn't been tracking him, but somehow the information was there. Ruth brightened. Oh, perfect. That's right through the courtyard, isn't it? I'll just pop through. She headed toward the interior doors that led to the courtyard connector, the shortcut between the ER wing and the rehab building. Claire watched her go, felt something shift in her chest. Not alarm, not quite. Just a sense of wrongness she couldn't name. She returned to step down. The afternoon stretched toward 1 o'clock. Claire checked her patients again. Everyone stable, no changes. She charted updates, responded to a family question about visiting hours, helped transport move a patient to radiology. At 1:15, she was restocking an isolation cart when she heard it. A scream, not the controlled cry of someone in pain, not the startled yelp of surprise. Raw, primal terror. It came from the direction of the courtyard. Claire's body moved before her mind caught up. She dropped the supply box and ran. The hallway to the courtyard was empty. Her footsteps echoed off tile. She hit the double doors and burst through into afternoon sunlight that felt suddenly too bright. Ruth Bennett stood in the middle of the courtyard path, hands over her mouth, flowers scattered around her feet in a spreading puddle of water from the broken vase. Tyler Kane lay on the ground 10 feet away, not moving. Claire's training took over. Assessment mode, instant, automatic. She ran to him, dropped to her knees on concrete still warm from the sun. Tyler? Her voice was sharp. Command voice. Tyler, can you hear me? No response. She checked for breathing. Put her ear near his mouth, watched his chest. Nothing. Carotid pulse. 2 fingers pressed to his neck. She counted 5 seconds. Nothing. Her brain processed this information with clinical detachment while her hands were already moving. Head tilt, chin lift. Check the airway. Clear. She looked up. Ruth was frozen, staring. Call a code, Claire said, not loud, not panicked. But the authority in her voice cut through Ruth's paralysis like a blade. What? Call a code blue. Now. Tell them courtyard. Go. Ruth ran. Claire positioned herself. One hand on Tyler's sternum, one on top of the first. Arms locked, shoulders directly over the compression point. She'd done this before. Different locations, different circumstances, same mechanical truth. A heart that stops beating needs someone else's hands to do the work until it remembers how. She started compressions, hard, fast, 100 to 120 per minute. Her whole body weight behind each push, compressing the chest 2 inches, letting it recoil completely. Count in her head. 1, 2, 3, 4, 5. The courtyard was peaceful around her. Birds in the trees, water in the fountain, sunlight on flowers. Tyler's face was already going pale. 15, 16, 17. Claire's mind was 2 places at once. Here. Doing compressions. counting, monitoring. And somewhere else, a field hospital, a soldier on a stretcher. Blood everywhere, someone screaming for a medic. She pushed the memory down, focused on now, 30 compressions, switched to breaths. She tilted Tyler's head back, pinched his nose, made a seal with her mouth over his, 2 breaths, chest rise, adequate volume, back to compressions, 1, 2, 3. She heard running footsteps, voices. The courtyard was no longer peaceful. Someone skidded to a stop beside her, a nurse she recognized from ER, young. Scared. "Oh my God." "Get a bag valve mask," Claire said without stopping compressions. "And a backboard, move." The nurse ran. More footsteps. Dr. Price appeared slightly out of breath. He took in the scene. His face went through 3 expressions in 2 seconds. Shock, recognition, decision. "How long?" 3 minutes since I started. Unknown downtime before that. Rhythm, unknown. No defibrillator yet. Price swore. "Where's the damn code cart?" "Coming through the ER," someone called. Claire kept compressing. Her shoulders were starting to burn. She ignored it. 28, 29, 30. The nurse returned with a bag valve mask. Claire switched to breaths. 2. Watched the chest rise. Back to compressions. Price dropped to his knees across from her. "Let me take over. I'm good." "You've been going for 5 minutes. I'm good." She wasn't. But changing compressors mid-cycle risked losing rhythm. Better to push through until they had more hands. The code cart arrived. Crashed through the courtyard entrance on wheels that squealed in protest. 2 more nurses, a respiratory therapist. "Get him on the backboard," Price ordered. "We need to move him to the ER." "No." Claire didn't stop compressions. "Get the defibrillator here, now." Price stared at her. "We need to move him to... Moving him stops compressions. We've already lost 6 minutes. Get the monitor here or we lose him." Price's jaw tightened, but he nodded to the nurse. "Bring it." They positioned the backboard beside Tyler's body. Claire kept compressing while they slid it underneath. Barely a pause. Maybe 2 seconds. The monitor arrived. A tech she didn't know fumbled with the pads. Claire stopped compressions long enough to rip Tyler's shirt open. Buttons scattered. "Left upper chest, right lower ribs," she said. "Fast." The tech placed the pads, hands shaking. Claire resumed compressions while they connected leads. The monitor beeped, came to life. Everyone looked at the screen. Asystole, flatline, no electrical activity. The worst rhythm in cardiac arrest. The one that doesn't respond to shocks. Price's face went pale. Claire's didn't change. "Epi 1 milligram," she said. "Someone start a line." A nurse moved in with an IV kit. Struggled to find a vein on Tyler's limp arm. "I-O," Claire said. "What? Intraosseous. Drill it into the tibia. We don't have time for peripheral access." The nurse looked at Price. He hesitated. Claire stopped compressions. Locked eyes with him. "We are losing him every second you waste." "I-O now." Price nodded. The nurse grabbed the I-O kit from the crash cart. Positioned the drill on Tyler's shin. The mechanical whir of bone penetration sounded obscene in the quiet courtyard. But the line was in. Solid. Fast access. "Epi going in," another nurse called. Claire resumed compressions. The team was starting to synchronize, moving like a machine that had finally found its rhythm. Compressions, ventilations, medications, monitoring, but Tyler wasn't responding. 2 more minutes. Another round of epinephrine, still flatline. Claire felt sweat running down her spine. Her arms were screaming. She'd been compressing for almost 10 minutes. "Switch with me," Price said quietly. This time, Claire nodded. They switched on a count. 3, 2, 1. Price took over compressions. His technique was good. Textbook, but he was already tired. His compressions weren't deep enough. Claire watched the monitor. The flatline wasn't changing. Harder, she said. You're not getting depth. Price adjusted. Better, but not enough. Claire ran through differential diagnoses in her head. Why does a healthy 27-year-old Marine suddenly arrest trauma? Overdose, cardiac, metabolic, pulmonary, no signs of trauma, no drug history in his chart. Which left the others. Someone get his chart, Claire said. Medical history, medications, anything cardiac. A nurse ran. They were 12 minutes into the code now. Statistically, every minute that passed dropped survival rates by 10%. They were well past the point where most codes fail. Thinking about calling it, Price asked quietly, still compressing, but his voice carried the weight of someone considering surrender. No, Claire said. We've been at this for... I said no. The nurse returned with a tablet, pulled up Tyler's chart. Post-op shoulder surgery, no cardiac history, no medications except pain management. Healthy, active duty, no red flags. Nothing that explained this. Claire's mind raced. Young, healthy, sudden arrest, no warning, electrical problem. Had to be. But why atropine, she said. Price looked up. For a systole, that's not protocol anymore. I don't care. Give it. The medication nurse hesitated. Do it, Price said. Atropine went in. They waited. 15 seconds, 30, 45, still flatline. Claire felt the weight of failure starting to settle. That familiar cold pressure that came when you'd done everything right and it still wasn't enough. She'd felt it before. On dusty roads, in field hospitals, in places where young people died despite perfect care. Not again. Not here. Not Tyler. We're moving him, she said suddenly. Now. What? Get him on the gurney. We need the ER. We need better equipment, better access. Move. They transferred Tyler to the gurney while Claire held compressions. The backboard slid across. Wheels locked. Brake released. They ran. Claire kept compressing while the gurney moved. Her footing was terrible. The motion made rhythm impossible, but she didn't stop. Through the courtyard entrance, down the hallway, fluorescent lights overhead, the squeal of wheels on linoleum. People jumped out of the way. A visitor pressed herself against the wall, hand over her mouth. A child pointed. His mother pulled him close, covered his eyes. The ER bay doors crashed open. "Trauma 2!" Price shouted. "Clear it now!" They wheeled Tyler into the bay, transferred him to the bed. Claire jumped up beside him, knees on the mattress, resumed compressions without missing more than 3 beats. The ER team swarmed. More hands, more equipment, more drugs. Someone intubated him. The respiratory therapist took over ventilations with the bag valve mask. They pushed more epinephrine, more atropine. Claire kept compressing. Her vision was starting to tunnel. Exhaustion and adrenaline and the mechanical repetition of trying to beat life back into someone who'd already let go. 20 minutes now. The room was full of people, but Claire only saw the monitor. Still flatline. Still nothing. "Claire," Price's voice, soft. "Claire, you need to stop." She didn't stop. "Claire!" Her arms were shaking, compressions getting sloppy. "Let someone else take over." She looked at him, saw something in his face she didn't want to recognize. Resignation. "No," she said. "We've done everything." "Not everything. What else is there?" Claire's mind was screaming. There had to be something. Some intervention, some drug, some technique. She'd pulled people back from worse. She'd saved soldiers with half their blood on the ground. She'd performed surgery with mortars landing close enough to shake the table. There had to be something. But the monitor didn't care about her history. It just kept drawing that flat line across the screen, mocking her, 22 minutes. Price put his hand on her shoulder. "Claire, it's time." And then the moment crystallized, everyone in the room watching her, waiting for her to stop, to accept what they'd already accepted. Tyler Kane, 27 years old, active-duty Marine, someone's brother, someone's son, lying dead on a hospital bed while a nurse who was supposed to be nobody fought alone against the inevitable. Claire looked at the monitor one more time. Flatline. She looked at Tyler's face. Gray. Still. She looked at her own hands, still positioned for the next compression. And something inside her broke. Not gave up, broke open. She leaned down, put her mouth next to Tyler's ear. "You don't get to quit," she whispered. "Not here, not like this. I didn't drag Marines through hell so you could check out in a goddamn courtyard. So you're going to come back. Now." She straightened, positioned her hands, and delivered compressions with a violence that made the bed shake. The room went silent. Even Price stepped back. Claire didn't care. She was past caring, past exhaustion, past pretending. She was just a combat surgeon trying to save a patient. Same as always. Different uniform. Same war. 30 compressions, hard, fast, precise. She would do this until her arms fell off. She would do this until someone physically removed her. She would do this because quitting wasn't in her programming. And then, the monitor changed. Not much. Just a blip. A tiny spike in the flat line. Everyone froze. Another blip, then another, then a rhythm. Chaotic, irregular, but a rhythm. Someone gasped. The cardiac monitor began tracking an actual heartbeat. Weak, thready, but present. "I've got pulse," the nurse at Tyler's wrist said, her voice breaking. "Weak, but I've got pulse." The room exploded into controlled chaos. Orders, medications, adjustments. Claire kept compressing for 5 more cycles, making sure, making certain. Then she stopped, checked the carotid pulse herself. There, faint, but there. She climbed down from the bed. Her legs nearly gave out. Someone caught her elbow. She stood beside the bed, watching the monitor, watching Tyler's chest rise and fall with the ventilator. Alive. Dr. Price was staring at her like he'd never seen her before. Maybe he hadn't. "Who the hell are you?" he asked. Claire looked at him, saw the question that had been building for 3 weeks, the question she couldn't avoid anymore. She opened her mouth to answer, and then the moment the truth would begin to cost her everything. Claire didn't answer Dr. Price's question. She couldn't. Not yet. Not with Tyler's rhythm still chaos on the monitor, and a room full of people watching her like she'd just performed a miracle instead of basic resuscitation. "Stabilize him first," she said. Her voice was steady despite the tremor in her hands. "Questions later." Price opened his mouth to argue, then looked at the monitor. The rhythm was there, but fragile, irregular. The kind of electrical activity that could collapse back into nothing if they breathed wrong. He nodded. "Right, okay. Everyone, let's secure this airway and get him moved to ICU." But he kept glancing at Claire like she might disappear if he looked away too long. The respiratory therapist adjusted the ventilator settings. Another nurse hung a new IV bag. Someone else was on the phone with ICU coordinating bed placement. Claire stood at the edge of the controlled chaos watching. Tyler's color was improving. Still pale, but no longer the gray of the almost dead. His chest rose and fell with mechanical precision. The monitor showed a heartbeat that was searching for normal and not quite finding it. She cataloged everything. Blood pressure low but present, oxygen saturation climbing toward 90%. Pupils equal and reactive when someone checked with a pen light. He was alive, but he wasn't safe, not even close. "What's the plan?" Claire asked. She directed the question to Price, but her eyes never left Tyler. Price was writing orders on a tablet, fingers moving fast. ICU cardiology consult, neurology to assess for anoxic brain injury. We need to know what caused this. EKG, Claire asked. Already ordered. Echocardiogram, yes. Troponin, BNP, complete metabolic panel tox screen. Price looked up. All of it. Who's running this code, Maddox? Their eyes met. The question had layers. Claire stepped back. You are doctor, just trying to help. You did more than help. His voice dropped. You brought him back from 23 minutes of asystole. That doesn't happen. It just did. How? Compressions? Medications? Time? Luck? Bullshit. Price's voice was quiet enough that only Claire heard him. I've been doing this for 12 years. I've never seen anyone compress like that. Never seen anyone refuse to quit when everyone else knew it was over. Claire said nothing. The ICU team arrived. 2 nurses and a resident who looked barely old enough to shave. They reviewed the chart while transport prepared to move Tyler. Claire watched them work. Good team, efficient, but they didn't understand what they were dealing with. He's going to arrest again, she said. Everyone stopped. Price frowned. What? His rhythm isn't stable. It's compensating. Whatever caused the arrest hasn't been addressed. He could go into VFib or VTAC any minute. The ICU resident bristled. We're aware of the risks. Are you ready for them? Claire looked at the transport team. Do you have a defibrillator on the gurney, amiodarone drawn-up crash cart following? The resident's face tightened. We know how to transport a critical patient. Then prove it. Claire turned to Price. I'm going with them. You're not assigned to ICU. I am now. She looked at him steadily. Unless you want to explain to his family why he coded in the elevator because nobody was ready. Price held her gaze for 3 seconds. Then he pulled out his phone and dialed. Janet Price. I need Maddox reassigned to ICU for the rest of the shift. I don't care about scheduling. Do it. Thank you. He hung up. You're assigned. Don't make me regret it. Claire nodded once. They moved Tyler with the careful urgency of people transporting a live bomb. Claire walked beside the gurney, one hand resting lightly on the side rail, eyes on the monitor. The hallway felt too long, too exposed. Every bump in the floor made her tense. Tyler's rhythm wavered, skipped a beat, recovered. Hold, Claire said. Everyone stopped. She watched the monitor. 3 seconds. 5. The rhythm stabilized. Go. They continued. The elevator ride was 48 seconds. Claire counted every one. Watched the numbers climb. Watched Tyler's rhythm hold. The doors opened on the ICU floor. They wheeled him into Bay 6. Corner unit, full monitoring. The ICU nurse who took report was a woman in her 40s with short gray hair and the calm expression of someone who'd seen everything. Her name tag read Patricia. What do we have? Patricia asked. Price gave the rundown. 27-year-old male, sudden cardiac arrest. 23 minutes of asystole before ROSC. Post-resuscitation rhythm unstable. Patricia listened, asked good questions, checked the monitor herself. We'll keep him on continuous telemetry, she said. Cardiology is on the way. Claire helped transfer Tyler to the ICU bed. They moved him on account, kept the leads attached, kept the IV lines untangled. Tyler looked small in the bed, younger than 27. The ventilator tube taped to his face made him look vulnerable in a way the uniform never did. Claire stepped back. Let the ICU team take over. They worked with practiced efficiency, adjusted equipment, updated the board, documented everything. She should leave. Her part was done. Tyler was stable enough. He had a full team now, but she couldn't make herself walk away. Patricia noticed. You can wait in the family area if you want. We'll update you when cardiology arrives. I'm not family. Then what are you? Good question. Claire was saved from answering by the arrival of Dr. Samuel Keaton. He was younger than Claire expected for a cardiologist, early 40s, wire-rimmed glasses, the kind of focused intensity that came from spending 12 years learning to read hearts like books. He went straight to the monitor, studied the rhythm with the concentration of someone solving a puzzle. "Talk to me," he said, without looking away from the screen. Price repeated the history. Keaton listened while pulling up the EKG on a tablet. His frown deepened. "This is strange," he muttered. "Strange how?" Price asked. Keaton zoomed in on the EKG. "The intervals are off. QT is prolonged, but not massively. And there's this." He pointed to something Claire couldn't see from where she stood. "This abnormality in the T-wave morphology. What does that mean?" "I don't know yet." Keaton looked up, noticed Claire for the first time. "Who are you, Claire Maddox? I was first responder." "You're the one who did compressions for 23 minutes." "Yes." Keaton studied her with open curiosity. "That's remarkable stamina." "I'm motivated." He almost smiled. Then his attention returned to Tyler. "I need an echo. Cardiac MRI if he's stable enough. Full electrophysiology workup." "You think it's electrical?" Price asked. "I think it's not structural. His arteries are clean. Echo from his shoulder surgery last month showed normal function. This is something else." "Like what?" "Like something genetic, something rare, something that's been hiding in his cardiac electrical system waiting for the right trigger." Claire felt something cold settle in her chest. Genetic. Hidden. Waiting. She thought about Emily, Tyler's sister, the one studying nursing, the one who shared his blood. "You need to screen his family," Claire said. Everyone looked at her. Keaton nodded slowly. "If it's hereditary, yes, first-degree relatives should be tested." "How fast can you get answers?" Claire asked. "Why, because he has a sister, early 20s, otherwise healthy. And if this is something she inherited too, she could be next." The room went quiet. Keaton's expression shifted. "You're right. I'll order the full genetic panel, but those tests take time, days at minimum." "Then we buy time," Claire said. "We keep him stable. We monitor everything. And we hope whatever this is doesn't run in the family." Patricia was updating the board with new orders when the ICU doors opened and Janet Morales walked in. She scanned the room, found Claire. Her expression was carefully neutral. "Maddox, my office now." It wasn't a request. Claire glanced at Tyler, still stable, still breathing, the monitor still showing that fragile rhythm. "Go," Price said quietly. "We've got him." Claire followed Janet out of the ICU. They walked in silence down a corridor that felt longer than it was. Janet's office was small, neat, a desk with 2 monitors, a wall of framed certifications, a window that looked out over the parking lot. Janet closed the door. "Sit." Claire sat. Janet remained standing, arms crossed, the kind of posture that preceded difficult conversations. "Tell me what happened." Claire gave her the facts. Timeline, interventions, outcome. Janet listened without interrupting. When Claire finished, she was quiet for a long moment. "Dr. Price called me from the ER," Janet said, finally. He was unsettled. About Tyler's condition. About you. Janet leaned against her desk. "He said you took control of the code, that you gave orders like you'd done it 1,000 times, that you refused to stop when everyone else wanted to call it." Claire said nothing. "He also said you jumped on the bed and did compressions with a level of aggression he's never seen from the nurse. I did what was necessary. That's what concerns me." Janet's voice softened slightly. "Claire, I need you to understand something. We're grateful. Tyler Kane is alive because of you. But what I watched on the security footage was—" She trailed off, pulled up her computer and turned the monitor so Claire could see. Security camera footage. Courtyard angle. Claire could see herself dropping to her knees beside Tyler. See herself starting compressions. See the moment she looked up and commanded Ruth to call the code. Janet fast-forwarded. ER Bay. Claire on the bed. Her whole body behind every compression. The look on her face. That look, the one Claire had worn in field hospitals. In combat zones. The one that said failure wasn't an option and death wasn't getting past her. "That's not how nurses move," Janet said quietly. "That's how soldiers move." Claire met her eyes. "I told you I was Army. You said combat medic. I was. Were you just a medic?" The question hung in the air between them. Claire could lie. She'd been lying for 3 weeks. One more wouldn't matter. But sitting here watching herself on that screen, seeing the truth of who she was written in every movement, the lie felt too heavy to carry anymore. "No," she said. "I wasn't just a medic." Janet nodded like she'd expected this. "What were you? Army. 3 deployments. I worked trauma. Forward surgical teams. Field hospitals. Places where you learn to make decisions fast, because slow got people killed. 68 Whiskey isn't a surgical MOS. I know. So, what was your actual designation?" Claire took a breath, let it out slowly. 61 Alpha, physician assistant. But I trained with the surgical teams, assisted on everything. By my 3rd deployment, I was doing procedures myself when we were short-staffed. Janet's expression didn't change. "So, you're not just a nurse?" "Yes, I am. I went to nursing school after I got out. I have a valid RN license. Everything on my application was true. Except the part where you conveniently forgot to mention you have trauma surgery experience. It didn't seem relevant. Didn't seem—" Janet stopped, took a breath. "Claire, you performed like a trauma surgeon today. You took command of a code in a way that suggested extensive resuscitation experience. You made clinical decisions above your pay grade, and you did all of it without asking permission. I saved his life. Yes, you did. And now I have a problem." Claire waited. "I have a nurse," Janet continued, "who is clearly overqualified for her position, who has been hiding significant clinical experience, who took control of an emergency situation in a way that suggests either remarkable competence or dangerous overconfidence." "Which do you think it is?" Janet studied her. "Honestly, I think you're the most competent person in this building right now, and that terrifies me. Why? Because I don't know what to do with you." Janet sat down in her chair. Suddenly, she looked tired. "If I promote you, I'm rewarding deception. If I discipline you, I'm punishing excellence. If I do nothing, I'm creating a liability because everyone in this hospital just watched you save a man's life with skills you're not supposed to have. I didn't ask for any of this. I know. That's what makes it worse." Janet rubbed her temples. Why did you come here, Claire? Why hide? Why take a floor nursing position when you could have applied for trauma surgery or at least critical care? Claire looked at her hands, still trembling slightly from the adrenaline crash. Because I wanted it to be over, she said quietly. I wanted to stop being the person who makes life and death decisions. I wanted to pass medications and check vitals and go home without hearing mortars in my sleep. Did it work? For 3 weeks? Janet almost smiled. Then her expression went serious again. Dr. Reeve wants to meet with you tomorrow. Chief Medical Officer. He's seen the footage. He has questions. I'll answer them. Will you? Janet leaned forward. Because you've been very good at not answering questions for 3 weeks. Claire met her eyes. I'll tell him what he needs to know. That's not the same as the truth. Sometimes it has to be. They sat in silence. Outside, the sun was starting to lower. The afternoon shift was winding toward evening. Finally, Janet spoke. You're on administrative leave pending review. Paid, not disciplinary. Just, we need to figure this out. What about Tyler? He's got a full ICU team. He's going to need more than that. Claire stood. Whatever's wrong with him, it's not simple. It's not going to be fixed with medications and hope. Someone needs to be watching him, someone who understands what complex cardiac electrical problems look like when they're about to fail. And you do. I've seen enough dying hearts to know when one is still trying to quit. Janet considered this. If Keaton requests your input as a consultant, that's his call. Until then, you're off the floor. Claire nodded, started to leave. Claire? She stopped at the door. Thank you, Janet said. For not giving up, for doing what no one else would have done, for being exactly who Tyler needed you to be. Claire's throat tightened. She nodded again and left. The hallway outside felt different. Louder. People looked at her as she passed. Some with curiosity, some with respect, some with suspicion. The story was spreading. Hospital gossip moved faster than infection. She took the stairs down, needed the movement, needed the mindless repetition of steps. In the stairwell, her phone buzzed. Text from Amy. Are you okay? People are saying insane things. Claire typed back, I'm fine. Tyler's stable. That's not what I asked. Claire stared at the screen. Didn't know how to answer that. Another text came through. Whatever you did, I'm glad you did it. He deserved someone who wouldn't quit. Claire put the phone away. She exited on the ground floor, started walking toward the parking lot. Her shift was technically over. She was on leave. There was no reason to stay. But halfway to her car, she stopped, turned around, went back inside, took the elevator to the ICU floor. Patricia was at the nurse's station. She looked up when Claire approached. Thought you left. Can I see him? You family. No. Patricia studied her for a moment. Cardiology is in there now, doing the echo. You can wait in the lounge. Claire went to the family lounge. Empty, except for a middle-aged couple holding hands in the corner. They looked up when she entered, then returned to their quiet conversation. She sat by the window, watched the parking lot below. Cars coming and going, people leaving work, visiting patients, living normal lives. She'd tried to have a normal life. It had lasted 3 weeks. Through the window, she could see the courtyard from above, the path where Tyler had fallen, the bench where she'd eaten lunch, the fountain still running, peaceful, innocent, until it wasn't. Her phone buzzed again. Different number this time. Unknown caller. She answered. Hello, Ms. Maddox, this is Dr. Keaton. I'm told you're still in the building. Yes. Could you come to ICU Bay 6? I'd like your opinion on something. Claire stood. I'm on my way. She found Keaton standing beside Tyler's bed, tablet in hand, frowning at an image that looked like moving shadows, the echocardiogram. What am I looking at? Claire asked. Keaton glanced at her. A structurally perfect heart that should not have stopped beating. He played the echo in slow motion, showed her the chambers, the valves, the walls contracting and relaxing with mechanical efficiency. Everything looks normal, he said. Ejection fraction is good. No valve disease, no wall motion abnormalities, no signs of cardiomyopathy. So why did his heart stop? That's what I'm hoping you can help me figure out. Keaton pulled up the EKG again. You've seen combat injuries, trauma. Have you ever seen electrical cardiac problems? Claire thought back. Field hospitals, blast injuries. Sometimes. Lightning strikes, electrical burns, severe hypothermia. Did any of them present like this? She studied the EKG, the intervals, the morphology, the subtle wrongness that suggested something deeper. No, she admitted, this is different. Exactly. Keaton zoomed in on a specific portion. This looks almost like long QT syndrome, but his QT interval isn't long enough for a definitive diagnosis. It's borderline, frustratingly borderline. What happens if it is long QT? Then he's at risk for a specific type of arrhythmia called torsades de pointes. It's a chaotic rhythm that can degenerate into ventricular fibrillation and sudden death. Claire looked at Tyler's still face. So, what he experienced today could happen again. Without warning, without trigger. Just happens. Treatment. If we confirm the diagnosis, we implant a cardioverter defibrillator, internal device that monitors his rhythm and shocks him back if he goes into a lethal arrhythmia. And if we can't confirm, Keaton's expression was grim, then we guess, and hope we guess right. Claire pulled up a chair, sat beside the bed, studied Tyler like he was a puzzle she could solve through observation alone. His chest rose and fell. His heart kept beating, but somewhere in the electrical wiring something was wrong. A glitch, a flaw, a ticking clock. His sister needs to be tested, Claire said. I know, Patricia is trying to reach next of kin now. Has anyone told her what happened? Not yet. We wanted to stabilize him first. Claire imagined getting that call. Your brother collapsed. His heart stopped. We brought him back, but we don't know why it happened. Emily would be terrified. When you reach her, Claire said, let me talk to her. Keaton raised an eyebrow. Why? Because she's going to have questions medical answers won't help with. She's going to want to know if he suffered, if he was scared, if someone was there. And you can tell her that I was there. I can tell her he wasn't alone. Keaton nodded slowly. Okay, I'll let you know when we reach her. They sat in silence for a moment. The ICU hummed around them, monitors beeping, ventilators cycling, the constant background noise of lives being maintained by machines. Can I ask you something? Keaton said. Go ahead. How did you know to keep going 23 minutes that's past the point where most codes fail, past the point where brain damage becomes likely. How did you know he could still come back? Claire looked at Tyler's hands. Young hands, strong hands, hands that should have decades left. I didn't know, she said. I just refused to accept the alternative. That's not clinical judgment. No, it's something else. What? Claire was quiet for a long moment. Stubbornness, she said finally. I've lost too many people who deserved better. I wasn't going to lose one I could still save. Keaton studied her with the same intensity he'd used on the EKG. You're not just a nurse, he said. Everyone keeps saying that. Because it's true. Claire stood. I should go. Let him rest. She started to leave. Claire. She turned. Keaton's expression was serious. Whatever meeting you have tomorrow with Reeve, don't downplay what you did today. Don't apologize for being competent. This hospital needs people who refuse to quit. Even if I bent the rules. Especially then. He looked at Tyler. Rules didn't save him. You did. Claire left the ICU. The elevator doors closed. She was alone with her reflection in the polished metal. She looked exhausted. Hair falling out of its tie. Scrubs wrinkled. Eyes carrying the weight of 23 minutes of compressions and 3 weeks of hiding. Tomorrow, she'd face Dr. Reeve. Tomorrow, the questions would come. Tomorrow, she'd have to decide how much truth to tell. But tonight, Tyler Kane was alive, and for a soldier who'd spent years calculating acceptable losses, that was a victory she'd take without apology. The elevator reached the ground floor. The doors opened. Claire stepped out into the lobby and kept walking past the front desk, past the gift shop, past the courtyard entrance where this had all begun. Outside, the evening air was cool. The parking lot was half empty. Her car sat exactly where she'd left it this morning. A lifetime ago. She got in, sat behind the wheel, didn't start the engine. Her hands were still shaking. She looked at them. These hands that had sutured arteries, stopped bleeding, restarted hearts. These hands that carried more experience than her badge suggested. These hands that had finally stopped hiding. Claire rested her head against the steering wheel and let herself breathe. Tomorrow, the reckoning would come. Tonight, she'd earned the right to just be tired. She started the car and drove home through streets that looked the same but felt different. Because everything had changed. And there was no going back to being nobody. Not anymore. Claire's apartment was small enough that she could see the entire space from the doorway. 1 bedroom, kitchen that opened to a living area with a couch she'd bought second-hand and a TV she never turned on. Windows facing east that caught morning light and nothing else. Spartan. Functional, temporary. She'd lived here 3 months and still hadn't hung anything on the walls. She dropped her keys on the counter, kicked off her shoes, stood in the middle of the living room trying to decide what to do with the hours before sleep. Her phone sat silent on the kitchen counter. No messages, no calls, just the quiet hum of the refrigerator and the distant sound of traffic on the street below. She should eat, shower, sleep. Instead, she sat on the couch and stared at nothing. Her hands had stopped shaking, but the adrenaline crash was coming. She could feel it building, the tremor in her chest, the exhaustion pressing down like physical weight. She'd been here before, after missions, after surgeries that went too long, after losing patience despite perfect technique. The crash always came. She closed her eyes, breathed, counted to 4 on the inhale, hold for 7, out for 8. Box breathing, taught in basic, refined in combat, used whenever the world felt too fast. 4, 7, 8, 4, 7, 8. Her phone buzzed. She opened her eyes, reached for it without enthusiasm. Text from a number she didn't recognize. "This is Patricia from ICU. Tyler Kane is stable. No changes. Thought you'd want to know." Claire typed back, "Thank you." Another buzz. Same number. "His sister is on her way. Should arrive around midnight. Dr. Keaton asked if you could be here when he tells her." Claire looked at the time. 8:47 p.m. 3 hours. She could sleep, should sleep. She typed, "I'll be there." Patricia sent back a thumbs-up emoji. Claire set the phone down. Stood. Went to the bedroom. She needed to change, shower. Look like someone who had their life together instead of someone who'd just spent the day dragging a Marine back from death. The shower was hot. She stood under the spray longer than necessary, watched the water circle the drain, thought about nothing and everything. When she got out, she caught her reflection in the mirror. Scars, small ones, mostly surgical, a few from other things, none visible when she was dressed. She'd kept her body in shape out of habit. Morning runs, body weight exercises, the kind of fitness that didn't require a gym or equipment or witnesses. Just discipline and repetition and the knowledge that physical capability was armor against uncertainty. She dressed in clean clothes, jeans, a plain shirt, civilian clothes because she wasn't on duty and showing up in scrubs felt wrong somehow. 9:30. Too early to leave. Too late to do anything useful. She made coffee she didn't want and drank it anyway. Checked her phone. No new messages. Sat on the couch again. Waited. At 10:45 she drove back to Harborview. The hospital at night was a different place. Quieter. Fewer people in the lobbies. The main entrance was locked. She used her badge at the staff entrance even though she was technically on leave. No one stopped her. The elevator to the ICU was empty. She rode up alone, watching the numbers climb. The ICU at night felt like a cathedral. Dim lighting. The soft chorus of monitors. Nurses moving with practiced quiet between beds. Patricia was at the station. She looked up when Claire approached. "You came." "I said I would." "His sister called 15 minutes ago. She's 30 minutes out." Claire nodded. "Can I see him?" Patricia glanced at Bay 6. "He's stable, still sedated. We're keeping him on the vent until cardiology decides otherwise." "Any changes?" "Rhythm is holding. A few ectopic beats but nothing sustained. Keaton thinks he's compensating." "For what?" "That's what we're trying to figure out." Claire walked to Bay 6. The curtain was partially drawn. She pushed it aside. Tyler lay motionless. The ventilator tube was still in place. IVs in both arms. Monitors tracking every beat, every breath, every electrical impulse. She pulled a chair close, sat down. His face was peaceful. Sedation did that. Erased the worry, the pain, the fear. But it also erased the person. Claire studied his hands again. They looked like they should be holding something, a rifle, a tool, something that gave them purpose. Instead, they lay still against white sheets. "You need to wake up," she said quietly. "Your sister is coming. She's going to be scared. You need to wake up so you can tell her you're okay." Tyler didn't respond. The monitor beeped its steady rhythm. Claire sat with him until she heard voices in the hallway. A young woman's voice, tight with stress. "I'm his sister, Emily Kane. Someone called and said he was here, that his heart stopped. Is he alive? Please tell me he's alive." Claire stood, stepped out of the bay. Emily Kane was 23 and looked younger. Dark hair pulled back in a messy ponytail. Wearing scrubs with a university logo. Eyes red from crying during the drive. Dr. Keaton was there. So was Patricia. Emily saw Claire and her expression flickered with confusion. "Are you a doctor?" "No," Claire said. "I'm the nurse who was with him when it happened." Emily's face crumpled. "Is he okay?" "They said his heart stopped, but they wouldn't tell me anything else." Keaton stepped forward. "Ms. Kane, I'm Dr. Keaton. I'm one of the cardiologists treating your brother. Let's sit down and I'll explain everything." They moved to the family lounge. Emily sat on the edge of a chair like she might need to run at any moment. Keaton laid it out clearly, concisely. No medical jargon, just facts. Tyler collapsed in the courtyard. His heart stopped. The team performed CPR for 23 minutes. They got his heart beating again. He was stable now, but sedated. Emily listened without interrupting. Her hands gripped the arms of the chair hard enough that her knuckles went white. When Keaton finished, she looked at Claire. "You did CPR for 23 minutes. Yes. Was he? Emily's voice broke. Did he suffer? Claire sat down across from her, met her eyes directly. No, she said. He wasn't conscious. He didn't feel pain, and he wasn't alone. I was there the whole time. Emily's eyes filled with tears. Why did this happen? He's healthy. He's a Marine. He runs 5 miles every morning. He doesn't smoke or drink or... She stopped. Couldn't finish. Keaton spoke gently. So that's what we're trying to understand. We've done initial tests. His heart structure is normal, but we think there might be an electrical problem. Something in how the signals move through his heart muscle. What kind of problem? We're not sure yet. We've ordered genetic testing. Advanced imaging. It's going to take time. Emily wiped her eyes with the back of her hand. Can I see him? Of course. Keaton stood. He's sedated so he won't respond, but you can sit with him. Emily followed Keaton and Patricia toward the Bay 6. Claire stayed in the lounge. She heard Emily's voice through the curtain. Soft, breaking. Tyler. God, Tyler. What did you do? You're supposed to be the invincible one. You're supposed to be... The rest dissolved into crying. Claire closed her eyes, leaned her head back against the wall. After a few minutes, Patricia came out. She wants to stay, Patricia said. We're going to let her. She's a nursing student. She knows the rules. Good. Patricia studied Claire. You didn't have to come back. Yes, I did. Why? Claire didn't answer. Patricia nodded like she understood anyway. Keaton wants to talk to you before you leave. He's in the consultation room. Claire found Keaton reviewing test results on a large monitor. Printouts spread across the table. His tie was loose. His glasses sat crooked on his nose. He looked exhausted. You wanted to see me? Claire asked. Keaton gestured to a chair. Sit. I want to run something by you. She sat. He pulled up an EKG. This is Tyler's rhythm from this afternoon. Notice the QT interval. Claire looked. She wasn't a cardiologist, but she'd seen enough EKGs to know normal. This wasn't normal. It's prolonged, she said. Borderline prolonged. But combine it with the family history. What family history? Keaton pulled up a different file. I asked Emily about sudden deaths in the family. Turns out their father died at 35, sudden cardiac arrest. No warning. Claire felt something cold settle in her stomach. Genetic, she said. Almost certainly. Keaton pulled up another image. I consulted with a colleague at Johns Hopkins. She's a specialist in inherited arrhythmia syndromes. She thinks this could be a variant of long QT syndrome. Rare. Difficult to diagnose, but fits the pattern. What does that mean for Tyler? It means his heart's electrical system has a defect. Under certain conditions, stress medication electrolyte imbalance, his heart can develop a specific type of dangerous rhythm called torsades de pointe. French for twisted points, Claire said. Keaton looked surprised. You know it. I've seen it once. Combat medic with acute hypokalemia. His rhythm looked like a sine wave. Exactly. And if torsades isn't corrected immediately, it degenerates into ventricular fibrillation and death. Which is what happened to Tyler. We think so, but proving it requires genetic testing and provocation testing we can't do while he's sedated. Claire leaned forward. What about Emily? Keaton's expression went grim. If Tyler has it, there's a 50% chance she has it too. Have you told her? Not yet. I wanted to confirm the diagnosis first, but... He rubbed his face. I can't wait. If she has it and we don't know she could arrest tomorrow, next week. We have no way to predict. What's the treatment? For confirmed cases, we implant a cardioverter defibrillator, internal device that monitors the heart rhythm 24/7. If it detects torsades or VFib, it delivers a shock automatically. And for Emily, if she has it, same thing. ICD implantation, medication, lifestyle modifications, genetic counseling. Claire sat back. She's 23 years old. I know. She's studying to be a nurse. I know. This is going to destroy her. Keaton was quiet for a moment. It's going to change her life, but it doesn't have to destroy it. People live full lives with ICDs. They work, exercise, have families. It's manageable. Manageable? Claire repeated. The word tasted bitter. It's better than sudden death. He had a point. Claire looked at the EKG again, those subtle abnormalities that hid a genetic time bomb. When will you know for sure? She asked. The specialist I consulted, Dr. Vivian Park, is flying in tomorrow. She'll review everything, run additional tests. We should have preliminary answers within 48 hours. And then we tell Emily the truth and hope she's strong enough to handle it. Claire stood. She will be. You seem certain. She's Tyler's sister. She's got Kane blood. They finish what they start. Keaton smiled slightly. You know them well for someone who just met them. I know soldiers. Same principle applies. She left the consultation room, walked past Bay 6, where Emily sat holding her brother's hand, talking to him quietly even though he couldn't hear. Claire didn't interrupt. She took the elevator down, left through the staff entrance, drove home through empty streets. Her apartment felt colder than when she'd left. She lay in bed staring at the ceiling until the sky started to lighten. Tomorrow, she'd face Dr. Reeve. Tomorrow, the questions would come. But tonight, she'd done what she could. And sometimes that had to be enough. The next morning arrived too soon. Claire's meeting with Dr. Malcolm Reeve was scheduled for 9 a.m. She arrived at 8:45 wearing the same clothes she'd worn to meet Emily. Professional, but not formal. She wasn't trying to impress anyone. Just survive the conversation. Reeve's office was on the administrative floor. Corner office. Large windows overlooking the same courtyard where Tyler had collapsed. Symbolic, maybe, or just unfortunate. His assistant, a woman in her 50s with the efficient kindness of career administrative staff, told Claire to wait. She waited. At 9 exactly, the office door opened. Dr. Reeve stood there. Early 60s. Silver hair. The kind of posture that suggested military background even in civilian clothes. Miss Maddox, come in. His office was larger than Janet's, dark wood furniture, diplomas and certifications covering one wall. A photo of Reeve in navy dress whites on his desk. So she'd been right about the military background. Sit, Reeve said. Not unkind, just direct. Claire sat. Reeve remained standing, hands in his pockets, looking out the window at the courtyard. I've watched the security footage 17 times, he said, from 4 different angles. I've read every report, talked to every person who was there. He turned to face her. You saved that young man's life with a level of competence that raises serious questions about who you really are. Claire said nothing. Janet tells me you admitted to being a combat medic. Army, 2 deployments. 3, Claire corrected. I lied about that part. Reeve's eyebrow raised. Why, 3 tours sounds intense. People ask questions. And you don't like questions. I prefer privacy. Reeve walked to his desk, pulled out a file, opened it. I made some calls last night, called in favors from my Navy days. Had someone pull your actual service record. Claire's pulse quickened. She kept her face neutral. Reeve read from the file. Captain Claire Elizabeth Maddox, Army, 61 Alpha Physician Assistant assigned to Forward Surgical Team Bravo. 3 deployments, Afghanistan twice, Iraq once. Bronze Star, Combat Medical Badge, multiple commendations. He looked up. You weren't just a medic, you were an officer. A surgical PA who ran trauma resuscitations in combat zones. Claire met his eyes steadily. Yes, sir. Why lie? I wasn't lying. I have a valid RN license. I went to nursing school after I got out. Everything on my application was accurate. Accurate isn't the same as honest. No, sir? Reeve closed the file, sat down, studied her with the intensity of someone trained to assess personnel. Why are you here, Captain Maddox? I'm not a captain anymore. Why are you here? He repeated. Claire took a breath, let it out slowly. Because I was tired, she said. Tired of making decisions that got people killed. Tired of triaging mass casualties and choosing who gets treated and who gets morphine and comfort care. Tired of washing blood off my hands and going back in for the next one. Her voice was steady, clinical, like she was describing someone else's life. I wanted to do something simple. Pass medications, check vitals, help people heal without having to decide if they were worth the resources to try. Reeve listened without interrupting. I came here, Claire continued, because I wanted to be nobody. Just another nurse, anonymous, forgettable, someone who could do good work and go home without nightmares. Did it work for 3 weeks? Reeve almost smiled, and then a Marine collapsed in the courtyard. Yes, sir. You could have let someone else handle it. No, sir, I couldn't. Why not? Claire looked at him directly. Because I knew they were going to fail. I could see it. The technique was wrong. The rhythm was off. They were going to call it and let him die because they didn't have the experience to know he could still be saved. That's remarkably arrogant. Yes, sir, but it was also true. Reeve leaned back in his chair. You know, I should fire you. Yes, sir. You misrepresented yourself on your application. You exceeded your scope of practice. You took command of an emergency situation without authority. Yes, sir. You also saved a man's life when no one else could have. Claire said nothing. Reeve stood, walked to the window again. I was Navy, he said. Submarine service. Did 20 years before I went to medical school. I understand the weight of command, the burden of knowing more than the people around you, the impossibility of standing by when you can act. He turned. I also understand why you wanted out. Claire felt something shift in her chest. Recognition. Understanding from someone who'd been there. I'm not going to fire you, Reeve said, but I'm not going to let you hide anymore either. Sir. This hospital needs your expertise. We need someone who can run trauma codes with combat-level competence. Someone who won't quit when the odds look impossible. I'm not qualified to... You're overqualified, that's the problem. Reeve walked back to his desk. I'm creating a position. Trauma Response Coordinator. You'll float between ER and ICU. You'll be available for codes for high-acuity situations for training staff on advanced resuscitation. That's not what I want. I don't care what you want. I care what this hospital needs. His voice softened slightly. I'm also making it optional for critical events. You can step back if you need to. Take breaks. This isn't the Army. You can say no. Claire looked at her hands. What if I say no now? Then I'll accept it. But I think you already know you can't. He was right. She did know. The moment she'd started compressions on Tyler, the moment she'd refused to quit, she'd stopped being able to hide. I have conditions, she said. Name them. No publicity. No stories for the hospital newsletter. No hero narratives. I do the work and go home. Agreed. If I step back from a situation, no one questions it. Agreed. And I want input on Tyler Kane's care. Dr. Keaton's good, but he's going to need help managing this case. Reeve nodded slowly. I'll talk to him. If he agrees, you can consult. Claire stood. When do I start? Tomorrow. Today, you're still on administrative leave. Use it to rest. She turned to leave. Captain Maddox. She stopped. Just Claire, sir. Claire. He picked up the service record file. For what it's worth, I'm glad you were in that courtyard. Glad you didn't stay hidden. Some skills are too valuable to waste on pride. It wasn't pride, it was self-preservation. Same thing sometimes. Claire left the office, took the stairs down, walked through hallways that felt different now. She wasn't hiding anymore. For better or worse, people knew what she was capable of, and there was no taking that back. She was heading toward the exit when her phone buzzed. Text from Dr. Keaton. Dr. Park arrived early. She's reviewing Tyler's case now. Can you be here in an hour? Claire typed back, on my way. She found Dr. Vivian Park in the ICU consultation room surrounded by monitors, printouts, and enough data to build a small library. Park was 50 Korean American with sharp eyes and the focused intensity of someone who'd spent decades studying one specific thing until she knew it better than anyone alive. She looked up when Claire entered. You're Maddox, the nurse who did 23 minutes of compressions. Yes. Park studied her with open curiosity. That's extraordinary stamina. What's your background? Army. Trauma resuscitation. Ah. Park nodded like that explained everything. Good. I need someone who understands complex cases. Sit. Claire sat. Park pulled up Tyler's EKG. This is fascinating and terrifying. What is it? A variant of congenital long QT syndrome, probably type 2 based on the morphology. It's genetic autosomal dominant, which means each child has a 50% chance of inheriting it. His sister, Claire said. Exactly. We need to test her immediately. Park pulled up more data. But here's the challenging part. This variant is subtle. It doesn't always show up on standard EKGs. The QT interval can look normal at rest. It only becomes apparent under stress, certain medications, or specific electrolyte conditions. So he's been walking around with this his whole life. Probably. His father died of sudden cardiac arrest at 35. That wasn't documented as genetic, but it almost certainly was. How do you treat it? ICD implantation, beta blockers, strict avoidance of QT prolonging medications, and lifestyle counseling. Lifestyle counseling. Park's expression was serious. He's a Marine, active duty, high stress, physical demands, all of which can trigger episodes. He's going to have to make choices. Claire understood what she wasn't saying. Tyler's military career was over. When will you tell him? Claire asked. When he wakes up, which should be soon. We're lightening sedation this afternoon. And Emily, I want to test her today. EKG echo exercise stress test genetic panel. If she has it, we start treatment immediately. Park stood, gathered her files. You saved his life, she said. Most people don't survive 23 minutes of a systole. The fact that he did with minimal brain injury is because you refused to give up. I just did my job. Your job was to be a floor nurse. What you did was operate as a trauma surgeon. Park smiled slightly. I'm glad you forgot your place. Claire almost smiled back. They walked to Bay 6 together. Emily was still there asleep in the chair beside Tyler's bed, her hand resting on his. Tyler's eyes were closed, but his color was better. The ventilator was still in place, but the settings had been reduced. Park checked the monitors, nodded to herself. "He's ready," she said. "Let's wake him up." And as the sedation lightened and Tyler began the slow climb back to consciousness, Claire stood in the doorway, watching. Watching as the brother who'd nearly died began to live again. Watching as the sister who'd nearly lost him held on tighter. Watching as the truth they'd both have to face came closer with every breath. Different room. Same fight. Just beginning. Tyler's return to consciousness was not dramatic. No sudden gasping awake, no thrashing against restraints, just a slow surfacing like someone swimming up from deep water toward distant light. His eyelids flickered, stopped, flickered again. Dr. Park stood at the monitor watching the sedation scores drop. Claire stood at the foot of the bed. Emily had been gently moved to the family lounge by Patricia, who'd explained that waking up with a breathing tube was frightening enough without an audience. Tyler's eyes opened, confusion first, then awareness. Then the immediate panic of realizing something was in his throat, preventing him from breathing on his own. Claire moved to his side before he could fight it. "Tyler." Her voice was calm, firm, the kind of voice that cut through panic. "You're in the hospital. You have a breathing tube. Don't fight it. Let the machine do the work." His eyes found hers, wild, searching. "You're safe," she continued. "You're okay. We're going to take the tube out soon, but you need to stay calm, breathe with the machine. Can you do that?" Tyler's chest heaved once, twice. Then he forced himself still. His eyes asked the question his mouth couldn't. "What happened?" Claire glanced at Dr. Park, who nodded. "Your heart stopped," Claire said. "In the courtyard, 3 days ago. We brought you back. You've been sedated since then while we figured out what went wrong." Tyler's eyes widened. His hand moved weakly, gesturing at his chest. "Your heart is beating now," Claire said. "It's stable. But we need to talk about why it stopped, after we get this tube out." The respiratory therapist stepped in, checked the ventilator settings, looked at Park. "He's ready," Park said. They explained what was going to happen. Claire held Tyler's hand while they deflated the cuff and pulled the tube. Tyler coughed violently, gagged. His throat was raw from 3 days of intubation. Patricia handed him ice chips. "Small amounts. Don't try to talk yet." Tyler took the ice, let it melt on his tongue. His eyes never left Claire's face. After a moment, he tried anyway. His voice was barely a whisper, shredded. "She's here," Claire said. "We'll bring her in soon, but first we need to talk." Tyler nodded slightly. Dr. Park pulled up a chair, positioned herself where Tyler could see her without straining. "Sergeant Kane, I'm Dr. Vivian Park. I'm a cardiac electrophysiologist. Do you know what that means?" Tyler shook his head. "I specialize in the electrical system of the heart. The signals that tell it when to beat." She paused. "You have a genetic condition called long QT syndrome. It's a disorder of those electrical signals." Tyler's expression didn't change. Maybe because he didn't understand. Maybe because he was too exhausted to process it. Park continued. "Your father died of sudden cardiac arrest when you were young, correct?" Tyler's eyes flickered. "Yeah." "He had this same condition. He passed it to you. It's genetic. So my heart is broken. Not a question, a statement." "Your heart structure is perfect," Park corrected. "But the electrical wiring has a flaw. Under certain conditions, stress, certain medications, electrolyte imbalances, your heart can develop a dangerous rhythm that leads to cardiac arrest." "Which is what happened." "Yes." Tyler looked at the ceiling. "Process this with the mechanical efficiency of someone used to receiving bad news and adapting to it." "What's the treatment?" We implant a device called an ICD, implantable cardioverter defibrillator. It's about the size of a matchbox. We place it under the skin below your collarbone. It monitors your heart rhythm constantly. If it detects a dangerous rhythm, it shocks you back. Shocks me? Yes, automatically. You'll feel it, but it will save your life. Tyler was quiet for a long moment. And if I don't get it? Park's expression was gentle but unyielding. Then the next time you arrest, you'll probably die. This condition doesn't get better. It doesn't go away. Without the device, you're at constant risk. What about my career? The question landed heavy. Park glanced at Claire. Claire stepped closer. Tyler, she said quietly, what does your MOS require physically? Everything. His voice was bitter. Endurance, stress tolerance, field conditions, deployment readiness. Can you do those things with an electrical disorder that could stop your heart without warning? Tyler closed his eyes. No. The word was barely audible. Claire watched him absorb it. The death of one identity, the forced birth of another. She'd seen this before. Soldiers who lost limbs, eyesight, the ability to serve in the only way they knew how. The grief was always the same. I'm sorry, she said. Tyler's jaw tightened. Don't. Don't what? Don't apologize. You saved my life. I should be thanking you. You can do both. He opened his eyes, looked at her with something that might have been anger or gratitude or both. They told me, he said, about the compressions. 23 minutes, that's insane. It was necessary. Who are you? The question was softer than when Dr. Price had asked it. Less accusation, more curiosity. Claire hesitated. Dr. Park stood. I'll give you two a moment. I need to talk to Emily anyway. She left. Claire pulled the chair closer, sat down. I was Army, she said. Combat surgeon. Forward surgical teams, 3 deployments. I've done a lot of resuscitations in a lot of bad places. Tyler studied her. You're not supposed to quit, are you? It's not in your programming. No, it's not. Me either. He looked at his hands. But I guess I don't get to choose anymore. You get to choose how you respond. That's not the same as choosing what happens. No, but it's the only control we ever really have. They sat in silence. The ICU hummed around them, monitors beeping, other patients breathing, other lives being maintained. Finally, Tyler spoke. Emily, does she have this too? We don't know yet. Dr. Park is testing her today. And if she does, same treatment, ICD, medications, monitoring. Tyler's expression crumpled. She's 23. She's supposed to have her whole life ahead of her, not this. She'll still have her whole life. It'll just look different than she planned. You're good at that. At what? Making terrible things sound manageable. Claire almost smiled. It's a survival skill. The door opened. Emily appeared, Patricia behind her. Emily's eyes were red but dry. She'd cried herself out over the past 3 days. Now she just looked exhausted and relieved. Tyler. Her voice broke on his name. Hey, Em. She crossed to the bed, took his hand. You scared me. I scared myself. Don't do it again. I'll try. Emily looked at Claire. Dr. Park wants to run tests on me. She says I might have what you have. Tyler's hand tightened on hers. Em, I'm so sorry. Don't. Emily's voice was firm. This isn't your fault. It's genetics. It's just what we got dealt. Kane blood, Tyler said with a weak smile. We finish what we start. Even if it's a genetic heart condition. Especially then. Claire stood. "I'll leave you two alone." Emily turned. "Wait, can I talk to you for a minute?" Claire nodded. They stepped into the hallway, far enough from the bay for privacy, close enough to see Tyler through the glass. "I don't know how to thank you," Emily said, "for what you did, for not giving up on him. You don't need to thank me." "Yes, I do. They told me. Everyone told me. You saved him when no one else could have." Claire looked at Tyler through the glass. "He's a fighter. He did half the work." "That's generous." Emily's voice dropped. "Can I ask you something?" "Go ahead." "The tests Dr. Park wants to run. If I have this, what does that mean for my career? I'm in nursing school. I want to work ER, trauma, high-intensity environments." Claire recognized the question, the fear beneath it. "I'm not a cardiologist," she said carefully. "But from what I understand, people with ICDs can do most things. Work, exercise, live normally. Most things, not all things." "No, not all things." Emily nodded slowly. "I always wanted to be like him, strong, capable, someone who runs toward emergencies instead of away. And now you might have to find a different way to do it." "Is there a different way?" Claire looked at this young woman who shared her brother's determination and was about to face the same forced recalibration of identity. "Yes," she said. "There are 1,000 different ways to serve, to help, to be strong. Your heart might limit some options, but it doesn't limit your courage, or your competence, or your right to do meaningful work. You sound like you've had to figure this out yourself." "Different circumstances, same principle." Emily wiped her eyes. "Dr. Park is waiting for me. I should go." "Emily," she stopped. "Whatever the tests show," Claire said, "you're going to be okay. It won't be easy, but you're Kane blood. You finish what you start." Emily's smile was small but real. "Yeah, we do." She left. Claire stood in the hallway watching through the glass as Emily returned to Tyler's bedside, watching them talk, hold hands, face the uncertain future together. The tests ran all afternoon. Emily's EKG showed the same subtle abnormalities as Tyler's. Her echo was normal, but the exercise stress test revealed what Park had suspected. Under exertion, Emily's QT interval prolonged dangerously. Her heart's electrical system showed the same flaw. She had it. Dr. Park delivered the news in the consultation room with the same gentle directness she'd used with Tyler. Emily listened, asked questions, cried briefly, then straightened her shoulders and asked about treatment options. Claire watched from the doorway, admired the resilience, the refusal to collapse under the weight of bad news. Kane blood indeed. Over the next week, the pieces fell into place. Tyler's ICD was implanted on day 5. A minor surgery, in and out in 2 hours. The device sat beneath his left clavicle, a small bump under the skin that would monitor every heartbeat for the rest of his life. He woke up from anesthesia, asking when he could go home. Emily's ICD was implanted 2 days later. Same procedure, same outcome. Brother and sister both carrying electronic guardians in their chests. Claire visited them both during recovery. Tyler was restless, already planning his medical discharge from the Marines. Emily was quieter, processing what this meant for her nursing career. But they were alive, and they were together. On day 8, Dr. Park cleared Tyler for discharge. Claire found him in his room, dressed in civilian clothes that hung looser than they had a week ago. Emily sat in the visitor chair, her own discharge scheduled for the next day. "You're leaving," Claire said. "Finally." Tyler was signing discharge papers, scrawling his name with the impatience of someone who'd been confined too long. No offense to this place, but I never want to see another hospital room. Understandable. He looked up. I wanted to say goodbye. And thank you, again. You already did. Not enough. He set the pen down. I've been thinking about what you said, about finding different ways to serve. And I've applied to the VA, patient advocate position, using my experience to help other veterans navigate the system. Claire felt something warm settle in her chest. That's good work. It's not the Marines, but it's something. Sometimes something is exactly right. Emily stood. I'm going to grab coffee. Give you two a minute. She left. Tyler waited until the door closed. Can I ask you something? He said. Go ahead. That day, in the courtyard, when you were doing compressions, did you ever think about stopping? Claire considered lying, decided he'd earned the truth. Yes, she said. Around minute 20, when the monitor was still flatline and everyone was looking at me like I'd lost my mind. I thought about stopping. But you didn't. No. Why? Claire looked at him. This young man who'd nearly died, who'd lost his career but kept his life, who was choosing to serve in a new way. Because I've lost too many, she said quietly. I've watched too many people die despite perfect care. I've made too many calls I can't take back. And I decided a long time ago that if there's even a chance, even a fragment of possibility that someone can be saved, I'm taking it. Even if it's crazy, especially then. Tyler nodded slowly. I'm glad you're crazy. Me too. He stood, extended his hand. Claire shook it. His grip was firm. Alive. If you're ever in the area, Tyler said, look us up. Em and I are going to have matching scars and ridiculous medical stories. We'll buy you dinner. I might take you up on that. Good. He left with Emily, both of them walking a little slower than they used to, both of them carrying devices that would keep them alive, both of them moving forward into uncertain futures with Kane determination. Claire watched them go. Then she returned to work. The new position Dr. Reeve had created came with an office barely larger than a closet, and responsibilities that varied wildly from day to day. Some days she trained ER staff on advanced resuscitation techniques. Some days she consulted on complex cases. Some days she responded to codes and ran them with the quiet competence that no longer surprised anyone. She didn't make friends, didn't seek attention, just did the work and went home. But the nightmares were less frequent. The hypervigilance was still there. Probably always would be. But it felt less like a burden and more like a tool she could choose to use. She was still a soldier, just fighting in a different room. 3 weeks after Tyler's discharge, Claire was restocking a crash cart when her phone buzzed. Text from an unknown number. This is Tyler. Emily and I are both doing well. Device is working. No incidents. Hope you're good too. She smiled, typed back, glad to hear it. Stay out of courtyards. His response came immediately. Ha, will do. Thanks again for everything. You gave us our lives back. Claire looked at the message for a long moment. Then she typed, You both did the hard part. I just bought you time. She put the phone away, finished restocking the cart, returned to the ER where a new patient was arriving. Chest pain. Possible MI. The team was mobilizing. Claire watched them work. Good technique. Solid communication. They didn't need her. But she stayed anyway, just in case, because that's what she did. That's who she was. Not hiding anymore, not pretending, just existing in the space between her past and her present, using the skills she'd carried from war to help people who'd never see a battlefield. Different uniform, same fight. The ER doctor glanced at her. You staying for this Just observing, Claire said. We've got it covered. I know. But she didn't leave, and when the patient's rhythm started to deteriorate, when the team's movements became uncertain, when someone looked around for help, they weren't sure how to ask for. Claire stepped forward. Not loud, not dramatic, just there. Switch compressors, she said quietly, and someone get me epi. We're not losing this one. The team moved, following her lead, trusting her competence, and the patient's heart found its rhythm again. Later, walking to her car through the parking lot, Claire thought about Tyler and Emily, about the courtyard where it had all started, about the choice she'd made to stop hiding and start using the skills she'd tried so hard to bury. She thought about Dr. Reeves' words. Some skills are too valuable to waste on pride. He'd been right. The war had taught her to save lives under impossible conditions, to refuse to quit, to believe that one person's determination could change outcomes that looked predetermined. Those lessons didn't stop being useful just because she'd changed uniforms. The work was different. The stakes were different. But the principle was the same. Fight for every life. Refuse to accept preventable death. Use every skill, every ounce of knowledge, every fragment of experience to give people one more chance. Different room, same fight. And she was finally okay with that. Claire reached her car, unlocked it, sat behind the wheel. Her phone buzzed again. Email this time from Dr. Park. Just wanted to update you. Tyler's genetic results came back. Confirmed LQTS type 2. Emily's results match. Both siblings are on appropriate treatment protocols. They're doing well. Thank you for your consult and for saving Tyler's life. It made the rest of this possible. Best VP. Claire read it twice. Then she started the car and drove home through streets that felt less foreign than they used to. Her apartment was still small, still temporary, still mostly empty, but it felt less like a hiding place and more like a home. She made dinner, ate slowly, watched the sun set through her east-facing windows that caught the last light. Tomorrow there would be more patients, more emergencies, more moments where her skills would matter. Tomorrow she would show up and do the work, not as Captain Maddox, not as a combat surgeon, not as the person she used to be, just as Claire, a nurse with a complicated past and hard-earned competence. Someone who'd learned that service didn't end when you changed uniforms. It just changed shape. She thought about Tyler one more time, remembered his question in the hospital room. Will you ever tell me about where you learned all that maybe, when you're ready to hear it without turning it into a movie? Maybe someday she would. Maybe someday she'd be ready to talk about the field hospitals and the impossible choices, and the soldiers she'd saved, and the ones she couldn't. But not today. Today it was enough to know that she'd used those experiences to save one more life, to give Tyler Kane and his sister a future they almost didn't have. Different room, same fight, same commitment to not quit until every possible chance had been exhausted. Claire finished her dinner, washed the dishes, prepared for tomorrow, and somewhere in Portsmouth, Virginia, a Marine and his sister went to sleep with devices in their chests, monitoring every heartbeat, keeping them alive, giving them time to figure out who they were now that their lives had changed. 3 people whose paths had crossed in a courtyard for reasons that looked random but felt inevitable. 3 people who'd learned that identity wasn't fixed, that skills transferred, that service was a choice you made every day, not a uniform you wore. 3 people finding new ways to fight battles worth fighting. Claire climbed into bed, closed her eyes. For the first time in months, she slept through the night without nightmares. Tomorrow, the work would continue. But tonight, she'd earned the peace. Different room, same fight. and she was finally ready to fight it. The end.